Hello everyone, I am Dr. Raktim and I am here to discuss on the topic of child death review. In my last video, I have discussed on the topic of maternal death review. Now, after maternal death, let us review about the child death. How a child death review is conducted and how is it different from maternal death review. So, when we say a child death, here all deaths under 5 years of age are considered for child death review. With this background, let us begin. So, what is child death review? Just like the maternal death review, here the child death review is a strategy to understand the geographical variations in the cause of child deaths. Like I said, in child death, it means 0 to 5 years of age. So, all the geographical variations for the cause of death of a child are considered here. It helps in initiating specific health interventions. Which area to focus on? What is the common causes of child death prevalent in the particular area? How to tackle with them? What strategies to follow to reduce the proportion of child death? All such interventions can be framed with the help of child death review. It helps in identifying gaps in the health service delivery and also the social factors which are important for social child death in the particular area. Thus, the child death review is being done. Moving on to the next slide of what are the types. Just like the maternal death review, here also we have the community-based child death review and the facility-based child death review. For the understanding of the child death review, in this video we will be discussing extensively on the community-based child death review. So what is community-based child death review? It is a strategy which is undertaken for deaths occurring in specified geographical area. The deaths which are considered for child death review are irrespective of the place where the child death is happening. It may be at home, at health facility, in transit. So, a community-based child death review is done when a death of a child happens at home, health facility, or in transit. But if we compare it with the maternal death review, the community-based maternal death review was done only when the maternal death was happening in a community level or in transit, but not in the health facility. If the maternal death was happening in a health facility, then the facility based maternal death review was done. But in case of child death review, the community based child death review is done irrespective of the place of child death. How it is, let us see. So, what are the steps of community based child death review? Just like the maternal death review, the number one and the foremost important point is the notification of the child death. It is very important. First, we have to notify it to the health facility. Secondly, after notification, the investigation will be done. How it will be done, we will be discussing it in the subsequent slides. But as of now, we have to remember that the investigation is done. Next, after investigating, we will be gathering a lot of data. So that data is transmitted through a certain channel. So we have to understand the data transmission and record keeping. After that, the analysis of these data is done and then appropriate action plan is framed. These are in general the steps of community-based child death review. It is almost the same for maternal death review, but I will be subsequently telling you specific differences between the two in my subsequent slides. Moving on to the next slide, in details, how the notification is done. In case of rural areas, primary informant is the ASHA. It can also be Anganwadi worker, ANM, Panchayat member or Panchayat secretary. And in case of urban areas, it is the link worker, Anganwadi worker of the municipal ward. One thing do remember is that In case of maternal death review, the primary informant can be ASHA, Anganwadi worker, or ANM, and sometimes local bodies working as NGOs, panchayat members are encouraged to notify. But here, in case of child death review, for the community based, it is primarily the ASHAs who are responsible as the primary informant. Secondly, the notification process is dual reporting. In case of maternal death review, anyone who ASHAs, ANM, or Anganwadi workers directly report it to the block medical officer. But here, in case of child death review, it is dual reporting. What is meant by dual reporting is that the ASHA, who is the primary respondent and the informant of the child death, she notifies the case of child death both to the ANM and the block medical officer within 24 hours through phone or SMS. This is the first difference between the two death reviews. So in case of child death reviews, there is dual reporting. The ASHAs will report it to the ANM as well as the block medical officer. Why this difference is there, we will be discussing it in next few slides. Okay, now let us go on to the next slide. ASHAs will fill the notification card by visiting the family. Since it is dual reporting, one copy would be handed over to the ANM and the other copy would be handed over to the family. This procedure is to be completed within 48 hours. All those bullet points are coming as a MCQ question. So please pay attention to it. So the notification card, which is to be filled up by ASHAs by visiting the families, this picture represents it. This procedure is to be completed within 48 hours. And after completing this procedure, the ASHAs will report it to ANM and the block medical officer. The block medical officer transmits all this information of child death that he or she has received to the district nodal officer every month. Again, you have to remember is that if there is no child death in any particular month, it is the responsibility of ASHA to report a nil reporting to the ANM and the block medical officer. And subsequently, the block medical officer will also report the nil reporting from that particular block, if there is nil in that particular month, to the district nodal officer every month. So the nil reporting is very much important. Moving on to the next slide. The verification of the child death is confirmed by ANM. In my previous slide, I told you that there is dual reporting. I told you that why there is dual reporting, I will be telling you in subsequent slide. This is the slide. The notification card are maintained in the sub center. This is an important MCQ question. The notification card for the child death review are maintained in the sub center. Whereas in case of maternal death review, all the notification card were maintained in the block medical office. So, since the child death review notification cards are maintained in subcenter, the ANM must be informed by the ASHAs in addition to the block medical officer. Moving on to the next slide now, how the investigation of the child death review take place. As I have mentioned that when there is ASHA notifying of a child death, the ANM will verify the child death has happened or not. In her investigation, the ANM does, it is known as the first brief investigation. It is conducted for all deaths which are notified by the ASHAs. Basically, it is carried out by ANM or it may also be carried out by some equivalent health worker. I have mentioned it in my previous slides that this notification is to be done within 48 hours. And after notification, The investigation of this child death by the ANM or the equivalent health worker is to be done within 2 weeks of notification. It is very much important to remember, as it is a frequently asked question in MCQ. The investigation by the ANM for the child death review is to be done within 2 weeks. The report, which is to be submitted by the ANM after her investigation, she submits the report to the block medical officer by 1 month of notifying the child death case. Okay, this is the first brief investigation which is done by ANM. The next step, as the information is reached to the block medical officer, the block medical officer is responsible to compile all the information of child death that has happened in his or her block, which is a collection of all the villages. The block medical officer will compile all the child death information, and then the block medical officer will pass on this information in as a summary to the district level every month. This data is transferred electronically. It is also an important thing to remember for us. Then, after all the information of a particular block is reached to the district nodal officer, the district nodal officer is the overall in charge of the planning and implementation of child death review in the district. After going through all the information of child death in the district nodal officer will select a particular block for investigation. This is the detailed investigation. Here, whenever a district nodal officer will select a particular block for investigation, there are certain points that he or she will uh, target upon for the detailed investigation report. Whatever block he or she chooses, the nodal officer of that block, that is the block medical officer, is responsible to conduct this investigation by verbal autopsy. So, how the district nodal officers select a particular block? The sampling criteria is as such that whenever a block is selected, a minimum of 6 cases per block per month is to be investigated. And in the block level, it is the responsibility of the block medical officer to conduct that particular investigation. Out of those 6 cases of that particular block, which the district nodal officer selects, the block medical officer is responsible to select the 6 cases in such a way that there are 2 neonatal deaths, 2 postnatal deaths in his selection, and 2 children deaths. With neonatal, it is 0 to 28 days of life, 2 postnatal, it is 29 days to 1 year of life, and 2 children means 1 to 5 years of life. Suppose there are no neonatal or the postnatal, and all the 6 cases are of children, then all 6 cases of children are selected. But if there are 6 cases distributed equally, then 2 each from the neonatal, postnatal, and children will be selected by the block medical officer. The priority of selection will be given to the common causes of death. Why priority is given to the common causes of death? Because after the detailed investigation, it will ensure to frame certain strategies and policy change in the healthcare delivery system so that these common causes of death can be addressed in the next time. So the priority is given to the common causes rather than to the uncommon ones. If somehow there is less than 6 child deaths, then all the deaths are investigated in details. This is the basis of detailed investigation, which is done by the district nodal officer with the help of block medical officer. Moving on to the next slide now. Apart from the first brief investigation and the detailed investigation report, there is one more component in the child death review, which we do not see in the maternal death review extensively. In case of child death review, we also do a social autopsy. Apart from this verbal autopsy for neonates and the post-neonates, social autopsy is carried out. Social autopsy is targeted to know about the social contributors for the child death, the behavioral contributors of the child death, and the health system contributors of the child death. A detailed social autopsy is carried out by each team, the ANM, the block medical officer, okay, to know about these situations and circumstances of why the child death have taken place. What are the social factors on which the child death has happened? To give you an idea of social autopsy, I have prepared a flowchart diagram in my next slide, which I would be discussing it. This social autopsy often comes as a short note in the exam. So let us know about the proceedings of social autopsy. How is it done? So first, the identification of death is done. It is notified by the ASHAs to the ANM and the block medical officer. After obtaining the requisite consent from the family, a detailed interview is conducted at each level, like I said, ANM and the block medical officer. So, at the household level, the interview is conducted and the mother or the caregiver is being interviewed using some standard questionnaires. And all the background information, the characteristics, the pregnancy, prenatal, natal, and postnatal delivery care, the illness history, the healthcare seeking behavior, the treatment received, from where it is being received, if there is a delay, why there is a delay, and the social, economic, and other environmental factors are noted down in by that interview. And then these things, the causes are analyzed in details. The certifying medical cause of death, the contributing factors that is leading to the child death, and the determinants of the gaps and the health system delays are analyzed after gathering this information. This review and discussion is taken up at each level. The community health workers, the health staffs, the review findings are then uh, screened for any factors or other information which is being left out, to identify these preventable factors and the recommended actions which may be taken to avoid child death. Based on this, the implementation of various measures to address this gap and to strengthen the health care delivery system is being done so that future child deaths are prevented. This is the background of social autopsy. Now, moving on to the next slide. After doing the social autopsy and the reports sent by uh, the ANM, the investigation team in the block level comprises of two persons, one from the medical background and the other from the non-medical background. Overall, in the block level, the block medical officer is the responsible for detailed investigation and reporting. Like in the previous level, the block level also do a detailed investigation with the help of this investigation team, and they undertake it within 1 to 2 months. It is important to remember 1 to 2 months of notifying of the child death to the district level. So after a detailed investigation done by at the block level, the report is summarized, compiled, and it is sent it to the district level. Subsequently, the data is transmitted from district to the state nodal officer each month. To assist the district nodal officer, there are two medical officers again to go through the review process done at the block level. So now let us briefly discuss about how the investigation at the block level take place. At the block level, like I said, the medical officer, the block medical officer is the overall in charge of this team at the block level. Then there would be one non-medical person as well. Secondly, there would be a staff nurse who can be also an A&M or technical support team. There would be health educators who would be liaising with the community. There may be Anganwadi workers, okay, to gather information of child death from the community level. So all those persons who are responsible to conduct a successful social autopsy is also a part of the review team at the block level. Thus, the Anganwadi workers, the community representatives, school teachers, and NGOs are also a part of this team. Overall, after the meeting, the data entry operator documents all the details and the reporting is done by the block medical officer to the next higher level, that is the district nodal officer. So this is a brief schematic diagram showing the investigation of a child death at the block level. From the block level, the information is electronically transferred to the district level. So at the district level, again there are two medical officers. The verbal autopsies forms are reviewed by these two medical officers and they will assign the cause of death. The DNOs, who are the district nodal officers, with the help of these block medical officers and the other doctors, these two medical officers who are trained for this purpose of reviewing verbal autopsy, they all work together in cohesion in preparing the detailed district report. And this district report is being reviewed at the level of district magistrate. All these uh, block medical officers, the district nodal officers, and the two medical officers who are recruited for verbal autopsy reviewing, they all decide to submit a total of 3 cases. These are important points for MCQs. 3 cases which will be reviewed in details at the district magistrate level. The selection of these 3 cases are done at the district level itself. And the district magistrate, after reviewing these cases, do the necessary changes and take appropriate action for reducing the morbidity and mortality of child. That is it for today's video. I hope you get the essence of child death review and how is it different from the maternal death review. One thing to remember is that for the child death review, this is taken up at a very stringent level. Though maternal deaths are a very sensitive issue, the child deaths are even more sensitive. And so a very strict and stringent action is taken to reduce the same. Thank you so much.